Alex, thank you for accepting to have this podcast. We have this discussion because Mr. Alexandru Ilie is one of the speakers of the Zumax event that will take place at the end of June. The reason we met today is because we want to find out something about Alex, something about his career, what he's doing in his day-to-day life, and also, of course, what he is going to tell us during his webinar. Alex, thank you for being with us. It's a pleasure to have you as guest in our event. Please tell us a few words as an introduction.
Thank you so much, Dan, for your kind introduction, and also for this this idea of promoting about what we will talk in the end of in the end of June. The story of me is very simple. I was a football player. Imagine, like a kindergarten, and at my 17th, I have a low back pain. And my parents decide that I have to, because I was already a professional. That means I have received money at that time to play football. You know, this is the difference between professional and amateurs. You've been paid or you pay. You know, and my parents says that you have to go to the physical therapy. I never heard about this idea, and I have been in touch with a very interesting approach with computerized, with math, and not simple exercises. And after 10 sessions, my back have been well recovered, and I have been, you know, 100% to be to be able to go to return to play. And this was my touch of you know, the idea of inspiring me. If I will not be able to become a real professional and make a history in football, to be a physical therapist. And this is when I was deciding if I will not be able to be a football player. I was a goalkeeper, like a position. I will start become a physical therapist, and this is how the journey have been started. Because after 3 years later, I have been decide to go to the this medical profession. I have been taking care about what all this anatomical, biomechanicals, because this is the most important thing when you talk about physical therapy, to well know the anatomical part and the biomechanicals. And then I have started become a practitioner. And after right now, I have more than 14 years of practice this profession, and I have been blessed to spend time with top athletes from tennis, like Florin Mergea. If people that listening this podcast is a well-known tennis player all over the world, and also some triathlonists. You know, the triathlon is a very high sport, like Ciprian Bălănescu and Mihai Baractaru is the first Romanian that have been able to go to the Miami, which is an important, the most important triathlon is there. The Ironman is a contest. It's the most well-known contest in the world. And yes, of course, all type of the patients that I was been, they have been come to me, and they have said that I'm not able to, I'm not been to the position to take a surgery. So the neurosurgeries decide that maybe I have to take care about my spine, because this is the most well-known position of me. I'm very focusing about recovering the spine, especially the cervical. And in the past 14 years already, I have been take care about many patients. I don't know exactly the numbers, but many patients with the spine issue, especially cervical, and of course lumbar. And what is very interesting, because we were talking about the dentist profession, is that in the, I believe, 3 years already, couple of, I think, more than 30 dentists, I have patients, and I have seen some patterns. because I say that most of them come with the same type of pain. And I say that when you tell me about this idea to talk about how to avoid the road from doctor to patient, I say I suppose that will be a very interesting topic because most of your college, I know already that they know a lot of things, some theoretical about how to work on the ergonomics perspective, but the daily practice show us that they don't respect this ideal position of working, and this is why they have a lot of muscular skeletal pain, especially the cervical.
So, Alex, you told us about your 14 years experience in the field of physiotherapy. But as far as I know, your last 2-3 years are totally different from what you were doing, let's say, before year 2020. And I would like to share your new business with us because this webinar that is going to take place at the end of June will be delivered worldwide. And there will be colleagues all around the world that will follow us. So they should understand why one reason for which we choose you to talk about dental profession connected disorders and not other physiotherapists. So from my point of view, you are one of the physiotherapists around the world that could really help directly and indirectly our colleagues if they need your help.
Yeah, I understand your point. So the idea was that from the start of the pandemic, in Romania was 16, I believe, March. They have locked down, all of people have been restricted, and they say that we are not allowed anymore to go on the streets. And then was the moment when I was thinking that because the phone is still ringing and patients are calling me because the pain have not go away, even that the pandemic have come. And they call me and say what I have to do. And I'm one of the guys that I do not recommend to have to take pills and to take this medicine in the pills way. And I say to them, maybe we can try what is very good working in the United States and about telemedicine. And this is when was the moment when I truly start thinking about putting together some my colleagues, other professionals, and create the first physical therapy platform in Romania, which was a great topic, a great idea, but not something very new in the world, because telemedicine and being able to do the specific exercise that you need for your dysfunction is something very common in States and many countries in the west of Europe, and especially the north of Europe. I'm talking about Sweden and Norway. And this was the point when I was starting to share people exercises and programs to manage their pain, because this is what we can do when we have our, to rebalance a joint. When we talk about the spine, we have a lot, thousands and hundreds of muscle that we have to approach them in the right manner. And for the beginning was I think a joke, because we start on the Facebook, we start with the phone, was nothing professional. But after 1 month, the reach of the people was incredible. From a couple of, I believe was almost 200 people that have been interesting about our content. After 1 month, we have been go more than 50,000 people that have been with us. And that was the moment with a good friend of mine, with Daniel, that we want to decide to put this in a professional world. And we made what today is named Restartix. It's the first physical therapy in the Romania platform, and is the the way that we help people all over the world. We have patients from all over the Europe and also the States. People are connecting with us and state about if they have some pain. So we talk about the symptoms, we make an evaluation with it's a live call, and then we do the consultation. If they have an MRI and other documents, they will send to us and we will take care about them, watch and analyze them. Also, we have a medical specialized in the recovery, which is in our team, in our professional teams, and also he's doing this type of consultation. And after all this personal consultation, we offer them a personal plan to recover and to manage their dysfunction. And especially more than 90% of our patients right now, because we have more than 2 years of experience, and in the platform we have more than 1,500 people already, which are our patients. They show to us that they have incredible good results by managing the pain. That means, imagine that you have a pain, let's say from 0 to 10, it's a 7, and after 1 month you go to 3 without medication, without pills, and without painkillers and all these stuffs. And this is what, in our opinion, it's an incredible success, because we truly can help people all over the world where it's possible. Because especially, when you have this herniation and it's a huge protrusion, then you definitely maybe you'll need a surgery. But from our experience, more than 90% of the people do not need the surgery. What they need is to start moving a little bit and start to recreate the natural balance on the spine, especially. And from there, they can manage successful their pain.
Thank you for your answer, Alex. As far as I know, you are also a researcher. You do your own researches, you publish articles. So you try to do whatever you do after a very, very careful research, and you base your indications and your therapies through scientific data. Please tell me or tell us a few fields in which you publish some articles, or what topics did you approach during your research?
First time was when I was communicating in this area of scientific, was with the help of dynamometer. Dynamometer means a device that you can test muscles, and then you can test and see the numbers, the force, the speed, the peak torque, the fatigue rate, and all this type of ratio between agonist and antagonist. And I have been conducting a study when we want to demonstrate that recovery with this type of the machines, that time was the Biodex. It was one of the most important company in the world that provides dynamometers. So recovery after the meniscus injury at the handball player was that time, was with almost 60% quickly than the traditional way, when you don't use this type of machines. So this was my first publication, and was truly very appreciated also today, because it's a reference in this type of recovery. And after that, I have made also an important communication in Romania, where I have have a study where I have conducted 50 patients. They have low back pain, no specific reason. So they have just symptoms and different type of symptoms, but without MRI. And I have applied them this physical therapy online. And we want to show them and want to provide a study where we're demonstrate that this type of programs that you can apply to your home and doing by yourself when you have time, when you decide it's Sunday, it's Saturday, it's Monday, whenever you want, but you have to respect the guidelines that the protocols it's offered to you by the physical therapist, really creates a difference. And we shown that all the have reduced their pain more than 50%, which was an incredible percentage. And all of them are free already, that they can be read. And right now we are very interesting about two subjects. One of them is in the corporate field, and we start a new study where we want to see if it's a if we can correlate sitting position with decreasing the activity on the PC worker. It's something that I truly believe that if you have back pain or if you have neck pain, and the most of the cause of this pain is that we sit too much, you are not too, your production is affected. So if your possibility is 100%, I believe when you have neck pain, for example, you work with less than 20% on your potential. And this is something I want to conduct. It's a study that we released to the corporate field, where we want to interview more than 10,000 of employees that are working daily in the sitting position. And now the most interesting subject is on the dentist. This is why all the people that will be joining on this presentation on the end of the June, I want to share with them with the link, and if they want to collaborate with us and answer it to the, I believe, our 13 question or 14 about seeing that daily practice of the dentist really create muscle dysfunction and joint dysfunction, and we want to see which are the most common. And then, of course, we want to offer them free consultation and, of course, a lot of benefits if they want to be part of these studies, to manage and to see if also with the help of physical therapy, we can improve the dysfunction, we can improve the pain, and also to improve the quality of their work, because this is the most important thing. We truly believe that when you have a pain, especially, let's say, in the shoulder, and I will speak more on this presentation, why the shoulder is very effective when you are working like a dentist, and also the sacroiliac joint is an important source of pain, of low back pain, because many dentists have come to me and say that they have low back pain and they don't have a disc issue, which is a good news in the beginning. But the main was the main problem was coming from the dysfunction of sacroiliac joint, and we have a couple of tests where we can relevate that if you truly have a dysfunction of this joint, or you have a disc joint of disc problem. So this is the next big thing that we want to do, and we truly believe that we can improve the quality of your work like a dentist, because a dentist with no pain, we believe, is a better dentist. Are you still with me? Do you hear me?
Yes, thank you for
Okay.
your answer. And now let's talk a little bit about what is going to happen on the 30th of June, because as far as you all know, there will be the Zumax Academy event, and we will talk a lot about dental microscopy. And one of the main advantages that the dental microscope brings to our profession is the fact that we can work in much more ergonomical positions. And that's why we thought that it would be interesting to have a physiotherapist to tell us something about the musculoskeletal disorders that we can achieve if we do not work correctly. So I think from both categories, I mean the dentists that unfortunately already experienced back pain, or the dentists that have no problems yet, we hope and we wish that they will not develop these problems in the future. So Alex, please tell us in a few words, what have you prepared for my colleagues in this webinar? Maybe a few tips and tricks, or maybe why they should really watch this webinar. What will they gain if they will be with us during this event?
So I believe the most important thing is coming from the title, because it's how to avoid the road from patient to from doctor to patient, because it's very important to understand that we are not talking about if the pain or if some muscle dysfunction will hit you. We will talk about when we will hit you if you'll not do the things that I want to share with you in this webinar, and also the tips that you can do it daily to don't have especially neck pain, and also the shoulder, because we will talk about the calcification of the shoulders, cuff rotators, which is very effective in the dental profession. We'll talk about more the importance of the thoracic spine and how to maintain the mobility and the ability to rotation, because it's very important to understand what type of dysfunction you'll be hit in the next period if you say like this guy on my back. This is why I have chosen this background, because when you sit down or and you adopt this bent forward position, the thoracic is very affected, and if you don't have a very health thoracic spine, not especially you'll have thoracic pain, but what you have to know is that you'll have low back pain, and we will talk about the correlation between low back pain and thoracic spine, and also we will talk about the headaches and the relationship between the ability to be focused, because it's most of the dentists have this type of deep contraction in the suboccipital muscles, and if they don't rebalance them, they will always be hit about this headache and that hardness of being able to focus on what you have. So I believe are many interesting subjects about how to avoid headaches, how to avoid neck pain, and if you have already neck or lumbar pain, what you have to do to quickly fix them without medication, and also to avoid the calcification of the cuff rotators, which is one of the most effective joints in our body if you work like a dentist.
So thank you very much, Alex. The most important thing that is that this event, the Zumax Academy, the first edition of Zumax E-Academy, is a completely free event. You just have to register online and to be online with us on the 30th of June. Alex will be there. We also have two dentists, two very well-known speakers that will talk about dental microscopy, specific topics about dental microscopy. And as I told you already, the event is for free. Thank you, Zumax company, for making this event possible. And once again, thank you, Alex, for being with us today to have this podcast and to tell a few things about what is going to take place during the live event, but also for sharing with us the information during your webinar. I know that you are a very busy person, and thank you once again because you took your time and agreed to record this podcast.
Thank you
once again.
Dan. Thank you so much for your invitation. I truly be excited about this first edition, and I truly expect a feedback. I don't know if it will be a good or a bad feedback, but I'm very curious about the way that dentists all over the world are thinking about improving their skills and their profession without improving with something specific. Because it's like when you are want to play at the violin. The first rule you have to play to be a good violinist to know how to play on the piano, and I believe this is something that applies also here. Maybe it's not most of the dentists think about that. If I have to be a good dentist, maybe the spine and the mobility and the things that I want to share with you are important to your profession. So I will be very, very happy if we will have a good feedback about this presentation that we'll have on the last week, I believe in June. No, 29 will be.
Yes, 30
29.
30
Yeah. 30
of
okay.
June.
I have to check about my calendar again.
30 of June. So Yeah. So, dear colleagues, we all want to have a healthy body. This healthy body will allow us to practice our profession as long as we would like to do it. The microscope is one thing that can help us to work more ergonomically. Also, Alex is here to help us to learn how to work more ergonomically and what we should do when we are not in the office in order to maintain our healthy body. So, Alex, thank you very much once again. See you at the end of June.
Thank you also for the invitation. See you soon, Dan.